My name is Chris Sterling. I'm a community health nurse here with Siksika Health Services. I've been working with Siksika Health for the last 6 years. My primary role is the immunization programs, so that would be our well baby immunization clinics, grade 6 and grade 9 school immunizations, as well as our flu and COVID clinics that occur every fall. CHIP was created to do two things. The first was to bring First Nations communities into the electronic records age. We didn't have a program that did that, and because we're separate from AHS, because we're federally funded, there was kind of a gap there, and CHIP did that. It allowed everybody to be transferred from paper files into electronic files. But what it also was done was to try and be a tool that can help you manage data, that can help you manage follow-ups, and just improve and be more efficient day-to-day work space for nurses so they can provide better and more quality care. Right now I can pull up in real time the percentage of kids that have received their measles vaccines, for example. And we can go, oh, we're a little low, or oh, we're doing well, and we can plan our next initiatives based off of that information and not have to spend a ton of time collecting it. We've always had a good, strong relationship with Okaki, and they were boots on the ground helping us here with our COVID-19 planning. They helped us set up our CDC team, which was the contact tracing team and also the support team. So that team did two specific things. In the beginning of the pandemic, we were doing contact tracing to try and prevent spread, but we were also connecting with families, usually on a daily basis where COVID was in the home, making sure everybody was doing okay. But the problem with that is tracking all of the people that are involved. That's a gigantic effort. And you need a system that is like real time that everybody can see. In Okaki, initially, we didn't have anything within CHIP that could do that for us. But they helped us develop an Excel spreadsheet that our nurses could use in real time and literally a line listing and develop that. And as we worked through that with them, they started to develop something called the CDOM module, which was essentially that Excel spreadsheet that was within CHIP. So everything was finally now in the CHIP records. It was whatnot. We weren't charting in different spots, and we were able to track. And it really worked to help us streamline our workflow dramatically. I cannot even fathom managing the COVID pandemic without that tool, or without those tools, or without the support of CHIP. As a result, Siksika had spectacular numbers when it came to vaccinations, and our outbreaks didn't get nearly as bad as even the province, for that matter. So we had better numbers when it came to percentage of the population that is sick, as far as I could tell from our data, which a lot of that stuff I was able to pull from the data that we had in CHIP, and then also to our death rates and stuff like that for COVID were a lot lower because we were able to maintain a program that allowed us to connect with families constantly. If that wasn't there, it probably would have been a lot worse. And that speaks completely to the infrastructure that CHIP provided us within its program. Because without that tool, we would not have been able to manage what we did. Simple as that.